All right, so we'll go ahead and get started. My name is Katrina Davis, and I'm with the Georgia Center for Oncology Research and Education. And welcome to part 2 of Your Voice, Your Power, our self-advocacy series focused on how cancer survivors can advocate for themselves after cancer treatment. So when life kind of has to go back to normal, what that could look like. And this webinar is currently scheduled to last from 5 until 6:30, but we may get out a little early, so look forward to it. All right, just a few housekeeping rules. We will be monitoring the chat and the Q&A throughout the webinar, so feel free to ask questions in any one of those that makes you comfortable. We will have all attendees on mute for the duration of the presentation. If you would like to ask your question verbally at the end of the presentation, we'll give you that opportunity as well. And as a disclaimer, this webinar is not intended to be a substitute for professional medical advice, diagnosis, or treatment. You are encouraged to confirm any information obtained from the webinar with other sources, including your medical team, and confirm anything that's related to your medical condition or treatment. Just a little bit about Georgia Core. Georgia Core is a statewide nonprofit that leverages partnerships and innovation to attract more clinical trials, increase research, and promote education to improve cancer care for Georgians in rural, urban, and suburban communities across the state. We work with partners across the state of Georgia to deliver survivorship programs and content to Georgia's survivors and caregivers. Tonight, we are working with the Georgia Cancer Control Consortium and the Survivorship Advocacy Council to bring you this webinar. If you'd like to learn more about Georgia Core, you can visit our website at georgiacancerinfo.org. Just a quick recap of last week's discussion. We talked about self-advocacy and what that really means. Self-advocacy to me is speaking up for yourself and sharing your voice with whoever that might be and how they might affect your care. So whether that's your care team, you're a cancer navigator, even your family and friends, is speaking up about what you need and what you need to take some responsibility for your care outcomes and what you need to be comfortable. Self-advocacy can be done in a variety of forms. So that means that could be going to a support group, or it could mean talking to your provider about what you need to understand a little better in your treatment plan, or even informing someone that you're in pain or that you need help. And lastly, we talked about kind of packing your tool bag with tools that will help you through your journey. So whether that means anything that we've just talked about, or having a resource manual for yourself to refer to, watching webinars, just becoming informed on your diagnosis and what that means for you in the future. If you'd like to watch the replay, you can do that at georgiacancerinfo.org in the media section. It's called Media and Video. All right, so we'll talk about some of the challenges that survivors may face after treatment. A couple of years ago, Georgia Core actually conducted a needs assessment for us to see what survivors were having issues with. And we found that survivors were having a lot of issues that weren't always being shared, even with physicians and nurses in the hospitals. So we lumped these concerns into different categories. They were physical, practical, emotional, and spiritual. Physical was involving the lasting toll that chemotherapy, radiation, or other treatments might have had on the body. So this could include chronic pain, lymphedema, headaches, nerve pain, anything like that that was affecting someone physically. Practical was related to some of the everyday things that we think about. Some of these items became very difficult for some survivors. So whether that meant facing what medical debt might be there after a diagnosis and treatment, difficulty resuming work and everyday responsibilities, things like that actually presented some stress for survivors. But emotional is next. So that could mean depression or anxiety, or just a powerful concern that the cancer could come back. We found that that was pretty popular as an issue amongst survivors. And lastly is spiritual. So some survivors said that they actually lost faith or hope, or they even thought about ending their lives, unfortunately. And this could be for a lot of reasons, and that's what we found in our research. Here are some of the stats behind the research that we did. So over 40% of survivors had issues with sleep. That's quite a bit. So we found that was pretty popular, and survivors were having trouble either falling asleep, staying asleep, or maybe even sleeping too much in some circumstances. Pain was also one that was high up there, including some of the pain that we talked about. Nerve pain was really popular. 38% faced financial issues. So that could have meant some unpaid medical bills, or either bills in real life that got behind because of the medical bills. 33% faced anxiety, and 31% faced stress, which was pretty popular amongst survivors. 30% also had difficulty managing household activities. So whereas some might find just sweeping or cleaning the kitchen very easily, some actually struggled with that throughout their journey. We had 20% who struggled with religious and spiritual support. So maybe the support structures they had in place at first don't work for them anymore, and they were struggling with that. And then lastly, we had 17% that were dealing with end-of-life thoughts. So all of these concerns that survivors have are valid, and we want to share tonight ways that survivors can advocate for themselves if they are facing any of those challenges. The first suggestion is that you can share your survivorship care plan with your primary care provider. If you don't have one, you can ask your oncologist and your care team to create a written summary of all of the treatments that you have received, any drugs, the dosages, the amount of radiation, et cetera, that you've received during your treatment. That way your primary care provider knows what has happened with you and how they can help you moving forward. You can also ask your oncologist and your PCP how they will share information related to your care in the future. I've worked at a hospital system, and sometimes the two don't talk. So sometimes you actually have to advocate for yourself to say, hey, I really need you all to send these records to my PCP so that they can know what has happened with my care. Next is stay informed about new research and developments in the treatment of your cancer and the late effects of the cancer. So as you all know, things change every day. So where something wasn't here yesterday, it could be here tomorrow. So keeping up with the latest research is a great way to see how things might be progressing for your particular cancer. And then you can take that information back to your care team to validate it, to see if it makes sense for you to do anything regarding that. Next, you could attend community cancer programs or participate in teleconferences that provide credible information for you. So sessions like this, sessions that other organizations offer, such as the American Cancer Society, Work Careers in Cancer, those are all really great resources to get credible information about your cancer. And next is be vigilant about monitoring your health. So for everyone, there are several different tests and things that you should get over the years in general, but when you have cancer, you definitely have to be more rigorous about staying on top of your follow-up appointments and maintaining your regular checkups. This will ensure that if you do have a recurrence, or if there's another cancer that you can prevent, you can stay on top of that. I wanted to share this resource from the George Washington Cancer Center, which is a form that's about I want you to know. This is a form that you could actually take to your provider team to say, this is the stuff that I want you to know about me. Sometimes you don't want to have that conversation, so this form will let you do it without verbally having to talk about it. So the form has boxes for you to answer what your pronouns are, your preferred language, your sexual orientation, and the people that you want involved in your care. It also has boxes for you to say what you would like to happen for you. So whether that means you want to be able to help them make decisions in your care, or ask questions about financial decisions, you can select that here. And then what I really loved about this is you could check off things that have been concerning you over the past 3 months. So maybe you've been concerned about transportation, money, or food, but you don't want to talk about it. You can check this box and provide this to your provider. And this document is available in English, Spanish, and Chinese, and it will be linked at the end of our presentation. Now we'll have introductions of our panelists tonight. First, we have Jade Gibson. Jade Gibson's success is primarily due to her ovarian cancer diagnosis at the age of 16. Navigating the transition from pediatric to adult oncology can be challenging where there is no roadmap to help address the barriers to care. Now 32 years old, Jade is using her voice to improve the quality of life for children, adolescents, and young adult fighters and survivors in Georgia. She has served as a resource connecting the dots to care for Georgians for the past 9 years. Her knowledge of state and federal programs has reduced medical debt and facilitated access to care for several uninsured individuals and families across the state. Jade's pursuit for advocacy began with her studies of patient navigation at the Harold P. Freeman Institute and extended into her academic studies of human services. Next is Dr. Crystal Champion. Dr. Champion has over 14 years of experience as a physical therapist. She is also a breast cancer survivor, and she was diagnosed in 2019. She is a certified lymphedema therapist and currently specializes in cancer rehab and also holds a certification in advanced lymphedema management. Dr. Champion is the owner of her own practice, Eminence Physical Therapy, and is also the executive director and founder of her nonprofit, Champions Can Foundation for Cancer Wellness Incorporated. Her organization advocates for cancer survivorship for patients with all cancer diagnoses. Dr. Crystal Champion also serves as an Elevate Ambassador for the National Coalition for Cancer Survivorship and serves on the GC3 Advocacy Council for Georgia Corps. She is the author of The Elements of Cancer Survivorship, A Guide to Navigating the Journey. Last is Marquita Bass. Marquita Bass is a breast cancer patient advocate who was born and raised in Atlanta, Georgia. She is a 9-year triple negative breast cancer survivor. Her goal is to educate women about the different types of breast cancers. Marquita believes women should understand and manage their breast cancer risk factors to possibly avoid a breast cancer diagnosis. In her book, Orange is the New Pink, My Battle with Triple Negative Breast Cancer, she encourages patients to have a positive attitude. She also advises patients to advocate for themselves by asking questions, getting second opinions, and learning everything they can about their breast cancer diagnosis. Welcome, ladies. I'm so happy to have you here. All right, so I would like to take just a moment for you all to just tell us about your background and what ultimately got you to this place in life today. I've personally worked with all three of you and I enjoyed all of the time so far. So we'll start with Jade.
Thank you, Katrina. Well, as you mentioned before, I am celebrating today exactly as my cancer anniversary. So I'm celebrating 16 years of survivorship from ovarian cancer. And coming from the pediatric space, it's just one that you walk that journey, and it's a lot different, I think, than it is for adult survivors, because I see the scope of healthcare through a different lens. I've traveled with it since I was young, and I know that for me, it's the potential to be at risk for other cancers or other late stage diagnoses over my lifetime. And that is what propels me to join in on the advocacy train and join in on the pursuits with the consortium and other projects that I associate with, because I definitely want to make an impact and have a lasting effect for the generation of fighters and survivors that are coming behind me.
Thank you. And congratulations, that's amazing. I'm glad that you are still here with us.
Thank you.
Next is Dr. Champion.
Thank you. So as I said earlier, by background, I am a physical therapist and lymphedema therapist specializing in cancer rehabilitation. And so I've been specializing since 2016. So I've always had a passion and a drive to help cancer survivors after the diagnosis, just to help restore their quality of life. And, you know, countless patients would come in to me and say, hey, Dr. Champion, now that I'm done with my treatments, you know, I'm left with this fatigue, or I can't lift my arm, or I'm too weak to go back to work. And so that actually pushed me to start a nonprofit to be able to support cancer patients and take a holistic approach. You know, you want to look at the physical functioning, the emotional well-being, financial well-being. And a lot of people said that they were missing all of those elements to help them get back to themselves after a cancer diagnosis. And in the middle of me helping people, I had no idea that I would be blindsided with a breast cancer diagnosis. So, so to speak, I had to take my own advice and walk the roadmap that I provided, you know, my patients with. So I had to give myself the same level of compassion and care and patience to also help myself to get through a personal journey with breast cancer.
Wow, thank you. I know that must have taken a different lens for you to have to put yourself in pretty much your patient's seat to see how you should navigate everything. But yeah, I think I'm just glad that you're here and glad that you can share your story with everyone. And I think that gives you another perspective just to be the provider and also the patient.
Absolutely. It's been very eye-opening to have a perspective from both sides of the table. So, you know, even though I am a healthcare provider, there are certain things that have happened to me, certain things that have slipped through the cracks. So I'm happy to share about that later in the webinar.
Thank you. Right, Marquita?
Hi, thank you for having me, Katrina. A couple of things have gotten me here. After I was diagnosed, I realized that a lot of breast cancer can be prevented, you know, especially cancer that's hormone positive. And my goal is to encourage women to, especially younger women, is to manage their breast health before diagnosis. And I want to encourage women to know their risk factors, manage those risk factors, and to be healthy. And secondly, I was diagnosed with triple negative breast cancer. And if you don't know, it's a breast cancer that does not respond to hormones and there's no targeted treatment. My aunt died from the same diagnosis less than a month after I had my surgery. And so consequently, I made a commitment to learn all I can about triple negative breast cancer, to encourage research to find treatments for early stage breast cancer, and to also just be a resource to other women and to show other women that you can survive triple negative breast cancer. It's not a death sentence. That's my goal. You can survive, and to encourage women to just be positive and just to be healthy and positive and, you know, push through whatever you're going through. And that's for any type of cancer, not just breast cancer, for any type of cancer. I've learned that your attitude really can determine your outcome. So just be positive as much as possible.
Thank you, Marquita. And you say that all the time, and I always think about you when I hear that, because it's true. Sometimes your energy and your positivity can play a big role in your health. All right. I am going to close this page while we have our conversation. So we'll be having a discussion about self-advocacy after treatment. So I do have a few questions for the panelists, and then of course we're welcoming questions in the chat as well. All right, so ladies, can you tell me how did life look for you after treatment or your surgery? What are some of the issues that you might have experienced that you weren't expecting to see after that was done?
I'll start. After my treatment was a double mastectomy, and no one told me that I wouldn't be able to lift, I would lose my range of motion in my arms. No one mentioned that to me. And I had a great plastic surgeon. And I remember going to his office. He was like, well, you know, move your hands like you're walking the wall. And I thought, I don't know if that's helping me. And this is where self-advocacy comes in. I decided to do some research, and there are physical therapists like Dr. Champion, and they specialize in helping women with regaining their range of motion. I had not heard that before. My plastic surgeon did not mention that to me. However, I went back to him and said, may I please have a prescription, to go to a physical therapist who specializes in, who works with breast cancer patients. But I don't know why it didn't occur to me that I would lose my range of motion, not being able to raise my hands. But, that was pretty traumatic. And you may think that doesn't sound like a big deal, but it really is when you can't raise your arms. That's on the physical part. I could not have anticipated the level of sadness that I experienced. And I'm talking about that period after treatment, when you're waiting, you may have a week or two before you have to resume work. And I was sad, and I didn't realize it until, this is kind of an embarrassing story to tell. My son came home from camp and he said, Mom, did you take a bath today? Did you bathe? And I realized that I was getting up in the morning, maybe or maybe not eating, and just watching TV. And that was my wake-up call to push through, to get up every morning and take a bath. And I had, mourned enough and to get on with my life. And I think that looks different for different people, but I didn't realize the level of sadness that I was going to experience. So I recommend talk to a counselor, talk to a good friend, go to a support group. But I don't know if you can go through any type of cancer and not feel sad. But I think it's important to recognize it and get the help that you need. So again, emotionally, I didn't anticipate the level of sadness, and physically, I didn't know that I wouldn't have full range of motion of my arms. But because I was a self-advocate, I did the research, I got the help that I needed, and I was able to move on with life.
I'll kind of piggyback off of Marquita's response. That was very good. And I will say, even though I'm a physical therapist, I was well aware of some of the physical limitations that could happen from having surgery. But I think I failed to realize exactly like how quickly that would happen. I also had loss of range of motion and developed something called axillary cording. And I said, oh my gosh, this is what my patients are feeling when they come to me. And they say they feel like something's tearing underneath their arms. So for me to actually experience what my patients were coming to me for was a very eye-opening experience. And I will also say, even though I'm a physical therapist, none of my physicians asked me how I was doing on my range of motion or asked me if I myself needed a physical therapist. There's certain things or treatments I can't do on myself, but nobody asked me, how is your physical functioning? I know you want to get back to work so you can help people, but do you need a therapist? I was never asked. Another thing I wasn't really expecting was I was diagnosed with stage 0 breast cancer. It was ductal carcinoma in situ. And in ways, to me, cancer is cancer. You hear the C word, you hear the C word. It doesn't matter what stage it is. And I was shocked to find how much, oh, well, you have stage 0 cancer. It's a baby cancer. You'll be fine. Like how much that was brushed off just because it was such in an early stage. And I also feel that because, I'm a younger woman and with stage 0, even as a healthcare professional, I slipped through the cracks in terms of my medical team making follow-up appointment recommendations for me. And in a way, I was made to feel that my stage 0 cancer didn't matter as much as someone that had stage 4 metastatic breast cancer or stage 2 or any type of other cancer. And so I really had to step up to the plate and say, okay, I had cancer. I know this is done for more advanced cancers, but I would like for you to check this particular cancer marker. I really need to know, as long as I'm on tamoxifen, how frequently do you want to see me in your office so we can get these appointments scheduled now? So it was a really eye-opening experience, like I said, just to be able to, people will say, oh, you need to follow up in this month or this month, but nobody calls you to actually follow up. So I've had a lot of patients I've had to coach through that are saying, my doctor told me to come back and get a blood test to have my prostate levels checked. Well, when was that? That was almost 2 months ago. And it's very alarming that, you know, post-cancer care, our follow-up appointments are slipping through the cracks. And it's so critical because, you know, as Marquita was saying, we also have anxiety and fear. You fear things coming back. And so it's so important that you keep those medical appointments and those checkups so that you're aware of what's going on with your body, and you can report when something doesn't feel right.
For me, I think because I was so young when I entered the healthcare system, it was never really a thought as much, I want to say, as far as what physical or cognitive impairments that I might have had after being treated for my cancer. I initially had 2 surgeries. The first, of course, was for tumor removal, and then to remove an ovary, as well as one of my fallopian tubes. The second was a follow-up to remove any remaining lymph nodes that were cancerous. And those were pretty invasive procedures for me to have at that age, roughly within a few months of each other. So just after I'd started to heal, I had to go back in for the second surgery because being on 3 different types of aggressive chemotherapy treatments was not doing enough. And those were cisplatin, etoposide, and bleomycin. Cisplatin being the worst of the 3 to have. And you're talking about 8 rounds for roughly a couple of weeks stay in a hospital for about a 6 to 8 month period of time. So for me, you kind of, when you're in the pediatric, when you're kind of in a bubble, you're kind of a little celebrity in your own right, if you will. And the supports that are around you in that system really do a great job. Our child life specialists, and our practitioners, they do a great job of really kind of focusing that attention on the medical, dealing with the parents, letting the child be a child. So I was grateful for that experience. However, post-treatment, I started, as I aged up, I actually started to notice that the people around me were not there as consistently as I was. And so you do develop a sense of loneliness in that can be a little bit of depression because during the time, I think at that point, 2005, social media is actually starting to become a buzz, Facebook, and you're looking at other teenagers around you that are doing, going to school and doing activities, prom and things that you should be doing, but you're not able to really engage in as you would like. It does become a bit of nerve-wracking because even your family members kind of coddle you just a little bit too close to the vest because they see you in a different light as well. You're not able to do certain things that other children your age would normally be able to do. So you're kind of isolated in that way. And a lot of AYAs, we kind of tend to feel that way as we go through our experience because there's not very many people that can relate to that journey, especially that part. So for me, I will say I definitely suffered in silence and had been probably up until a few years ago, not having the knowledge on how to really adequately go about processing what steps do I take to address my mental health needs. How do I put that into terms to where I can accept that I need the help? And then how do I start this process for myself? And when you're young, you don't know how to articulate. Something is, not right here. Ms. Marquita brings up a great point as far as mobility and just taking some of the basic things, being able to stand up and move about. When you have 2 lateral surgeries, you don't necessarily know that you use your back a lot. You're moving around a whole lot. You're walking, you're sitting, you're standing, and those things become very difficult to do having procedures like that that leave you impaired almost in a way for certain periods of time. And then the other thing that I wanted to point out, of course, was chemo brain, which to this day still seems to be something that just will not leave me. I think the treatments themselves also maybe have just caused some other cognitive impairments with memory lapses. I can't tell you where my keys are right now. I have to have a tile to press a button and let they are. So just some of those things that are lasting late stage effects, they don't tend to go away after treatment. And like I said, I'm 16 years out, but you just kind of, as you grow through this journey, you kind of figure out ways to maneuver and cope, and developing those strategies will help to live a very productive life post-cancer.
Katrina, may I say something?
Yes.
Dr. Champion, thank you for bringing up the importance of keeping up with your appointments and not assuming that it's going to be done for you. That's the first time I've heard someone say that. So that's something I'm going to share with people. That never occurred to me, that you have to own your care going forward, your maintenance care going forward. That never occurred to me until you mentioned it. So
absolutely. And like I said, I've had so many patients that, you know, certain lab values or blood work, what it shows is dependent on what happens in the next step of maintenance treatment, or if in some cases, if radiation is going to be needed or not. And so to miss critical follow-up appointments, I mean, it's really a life-changing thing. And so I always ask my patients, you know, do you have a follow-up? Are you aware of when your follow-up is? Well, I haven't heard anything. Call today, call now. So I'm always pushing people to make sure they're on top of that. It's so critical.
Thank you. Yeah, that's very important. And I think sometimes we give our providers too much leniency because sometimes they just get overwhelmed with patients. There's so many patients in the healthcare system right now that it's easy for them to push out calling a patient for an appointment by weeks. So it is important for us to make sure that picking up the phone or sending a message to make sure you get your appointment scheduled, and then you actually follow up with that appointment. I do have a question for Jade. So Jade, you said that you did struggle for quite a few years, even just kind of coming out of that a few years ago. Can you tell us about what the wake-up call might have been for you and how you reached out to advocate for yourself to say, hey, I'm ready to move forward with this, or I'm ready to address this for other survivors?
Absolutely, Katrina. Thank you for the question. It's wonderful. Me, I think I had gotten to a place, I would say professionally first, where I was trying to figure out how to bridge passion and practice. I'm passionate about my advocacy, but I'm not doing it enough. So there was a little accountability factor there. I had to start, and I'll say this, I tend to think of myself as very introverted, but I'm learning that I'm more of an ambivert. And so just, I think having to become more comfortable with who I was becoming, the person that I used to be, had kind of like shed her skin a little bit, if you will. And that growth just incited something in me to really not only take my health seriously, but it's first my physical health and wellness, but my mental. And I noticed that I hadn't been dedicating as much focus to that. And when I started to do the research, because I'm always Googling something, that's where I went to. And I started to Google and I started to look for things native to my area where I'm from, Macon, Georgia. And I started to call people I'd never called before. I'd been with my adult oncologist since I was, I think, 20 years old. I had never spoken to my navigator before. I had never been introduced to them. But I know from professional background as being a health insurance navigator, I knew that was at least the first place I could start with my own circle and then branch myself out. And that's what I did. Unfortunately, because of the patient population I'm attributed to, there's just not enough of us that collectively get together to form support groups. And so those resources locally just weren't there. But I adopted the mantra, have car, will travel. And so that pushed my research even further out. So if it's not local, where is it? And I would look up the cancer support community here in Atlanta. I started to call different social workers in those spaces of Northside and get more information. Just being more informed helped to kind of propel me to where I needed to be. And then, of course, in my Googling, I was also able to learn about other organizations like BetterHelp, which is an online platform where you have an option of thousands of providers and mental health professionals that are there 24/7, and they can match you with someone for your specific need to address whatever your needs are. And I said, well, that I can do. I can make the first step and be proactive, because I don't want to continue to have these blockages. I know that I'm meant to do more. I know that I'm meant to be more, but if I don't start applying myself, then I'll never be able to really grow and live to my full potential, if you will. So that was what projected me to do that.
Thank you. All right. My next question is, was there anything in particular that kept you all motivated during and after your treatment? Has it kept you encouraged along your survivorship journey, or have you discovered something new that's kept you encouraged since?
Just a second.
I'll start. Immediately after my diagnosis, and I guess it's different for everyone, because my son was just starting high school, he was really my will to live. You know, now that he's grown, I have other reasons for living, but at the time, that was the thing that I was able to grab onto. And that motivated me, you know, besides him telling me I need to bathe, you know, I need to move on, but that just motivated me to move on with my life and to not focus so much on the diagnosis, because that wasn't all of who I am. Mm-hmm. So I just jumped back into work. I focused on him, and, you know, he was a musician. I focused on his activities. I started teaching again, and I just took it one day at a time also. Because what happens is, oftentimes with any type of cancer, you're always thinking about the fear of recurrence. And I didn't want that to dominate my thoughts. So, you know, I just tried to dive back into life and live my life. And I adopted the mantra, I'm going to live every day as if breast cancer is not going to return. And that is what, you know, helped me to propel forward. And here I am 9 years later.
For me, I would say, you know, it was easy to kind of slip into a woe is me mindset. And, you know, when I was first diagnosed and after surgery, I go, you know, I'm treating and helping people every day. This isn't supposed to be happening to me. And so I gave myself a really hard pity party. But on the flip side of that was what really motivated me is that those cancer patients that I see every day, they are survivors and they have pushed through. And even with my nonprofit organization, the ladies that were helping me, my board members were all cancer survivors. And you know, it helped me to draw strength from being surrounded by cancer survivors and seeing that it's going to be okay. You're going to come out on the other side. And there is hope. Like I said, I've had people that have had way more intense treatments and things that I went through, but yet they're so positive and encouraging and uplifting and willing to just pour back into other people and share their stories. So for me, that ignited my fire even more to advocate for cancer survivorship and cancer patients. I said, I have to do this for what I feel is my purpose in life. And so that was a huge factor for me that pulled me out of I call the sunken place.
All right, Jade, did you want to answer that one?
Sure, Katrina, could you give me the question?
We were talking about what really kept you motivated during treatment and then after treatment. And have you seen that shift from maybe the beginning of your journey to now?
Oh my goodness. I would definitely say just having my family support kept me motivated. I think I had just a unique experience. God put me in the right places I grew up since I was 9 years old working in a wig boutique that was local to my area. So our specialty was actually working with patients who had been diagnosed with cancer or maybe suffered from alopecia or other specific diseases where they would need some type of cranial prosthesis. So I grew up with unique experience to share in those journeys. And it really just helped me develop an appreciation for the women and men and children, especially those who were a lot older than me. These were people with families, children. They had so much more going on, careers, and they were kind of like in the midst of things when cancer came to their door, and to see how they persevered. I think being in the process of my journey and still working there during the process on the weekends really helped me kind of extend that support system that I already had in place, and then empowered me to keep going through the process because you get different insights. You get to share, the similarities, and that way it was almost kind of like its own small support group. We had wig parties, so that was always fun. And I developed, I guess, a sense of becoming a wig connoisseur, if you would. But and that continued post-treatment. Just having that outlet, I think, also took me away from the cancer world, if that makes sense. Cancer, when I was not going to doctor's appointments for my follow-ups or just for routine things, scans and such, and it kind of helped to provide a little bit of balance of normalcy in life. They always talk about the new normal, which I don't think for me I've experienced just yet. Normal just kind of converted itself into whatever it was going to be post-cancer for me. And so I would say that for me.
Thank you. Well, back in the day, I used to wear a lot of wigs, so I probably would have been there. All right, so this question is for you, Dr. Champion. So you talked a little bit about this with your background. Can you tell us more about what cancer rehab is, cancer rehabilitation, and how important that is to the post-cancer recovery? And then also how survivors can ask their providers for this if they hadn't suggested it for them.
So cancer rehabilitation is what I call a multidisciplinary approach to restoring your physical functioning after having a cancer diagnosis. And what I mean by multidisciplinary approach is you have physical therapists such as myself that can help to address range of motion issues after surgery, lymphedema, which can be a side effect of cancer treatment, endurance, cancer fatigue. A lot of people don't realize that a physical therapist can actually give you strategies to help you get through that cancer fatigue that lingers around years after a cancer diagnosis. Neuropathy is a very common complaint, especially for people that have had chemotherapy. And it's a painful condition. Not a lot of people realize that instead of always having medication thrown at a condition or a side effect, that physical therapy can also be very effective in managing neuropathy or neuropathic pain for cancer survivors. Another team member would be an occupational therapist to talk about and give strategies for, making sure you can do your ADL activities. People that are struggling with bathing themselves and dressing themselves or house cleaning. There's different techniques and things that we call energy conservation strategies to help patients to be able to just function a little bit better in their day-to-day life. Another team member that actually gets overlooked is a speech therapist. We hear a lot about chemo brain, chemo fog, and when people hear speech therapist, they think, okay, I have a speech impairment, so they're going to help me with that, or I have a swallowing impairment, they're going to help me with that. They can actually give you cognitive strategies and help you with some of the short-term memory things that occur with chemo brain. And it's also important for example, patients that have head and neck cancer and have extensive neck surgeries and, radiation treatments, their ability to swallow and speak can be significantly impaired. And a lot of people just kind of forget about the actual speech therapy part of it. I've even had breast cancer patients who get radiation and they have tightness in the throat and difficulty swallowing because radiation field may have come up a little bit high. And so they're not aware of that. And, we recommend have a speech therapist to assess that. So that's something that a lot of people don't recognize. But I feel that every cancer patient should have a physical therapy assessment after going through treatment. Is so critical. People want to get their lives back. People want to go back to work. People want to interact with their children, their grandchildren. People want to feel good about themselves and have the energy to do what they want to do on a day-to-day basis. And so a lot of times when people are referred to me for physical therapy, I rarely get people in what I call that early phase where any physical issues that come up can be addressed quickly. I usually get them when things have progressed to a point to where it might be a little bit harder to treat and you're going to be in therapy a little bit longer. So I always tell people, as soon as you're able to, after your treatments or after surgery, it can be your primary care, it can be your oncologist, your radiation oncologist, your surgeon. Ask your physicians for a referral to a physical therapist. And physical therapists, we have the ability to refer out. So if a patient comes to me, I'm seeing them for physical therapy, but I feel that, okay, this patient would also benefit from occupational therapy or speech therapy needs that haven't been identified. I can also contact that patient's doctor and advocate for them for those additional services. Some people want to get back to that pre-cancer lifestyle. And so some people think they can immediately go and run a marathon after having a cancer diagnosis, and you're going to hurt yourself. So it really is important that you get to a trained medical professional to help guide you in the right direction in terms of return to activity, return to function. What are your goals for life? What is it that you can't do that you want to get back to? And then don't be afraid to share that with your doctors. Like I said, even having early stage cancers, if you have a surgery, regardless of what it is, you're going to have some type of physical or functional impairment. I had range of motion issues. I had post-surgery fatigue, pain, numbness. There were just issues. And so it's so important that those things are addressed and caught early. And sometimes post-treatment, it can affect other body systems. And a lot of patients don't realize that. I have frozen shoulder and I don't understand why. And so, well, that can be a side effect of radiation. Or I'm leaking, cervical cancer survivors. I now have issues with urinary leakage and incontinence, or I leak urine when I cough and sneeze. And they don't realize that physical therapy can help what we call those pelvic floor issues that can occur from surgery and radiation, especially for gynecological cancers, including prostate cancer. So, there's more solutions to physical discomfort rather than having to always take a pill to remedy the problem.
Dr. Champion, do you have any opinion on acupuncture and massage therapy to help with some of the pain?
It can be very effective, but I always caution people to talk with your healthcare team and make sure that it's okay. Because a lot of things are dependent on what other medical issues that you may have. For example, if you have lymphedema, which is swelling in an arm or leg after cancer treatment, one of the precautions for lymphedema is to avoid blood pressures or needle sticks in that affected side. So you may not want to go to acupuncture and have someone do that to your affected swollen limb, because that can exacerbate or make your symptoms worse. Or a massage therapist who is not aware of you're at risk for lymphedema for something, and they're too aggressive on a deep tissue massage and they trigger inflammation that can onset lymphedema. So there are certain things to be really careful about. And that's why it's so important to get to, like I said, a physical therapist, occupational therapist, speech therapist, people who are well versed in the do's and don'ts and the things to look out for when looking for those alternative holistic treatments.
That's a great question, Marquita. And I have a question for you, Marquita, from the audience. Did you get a survivorship care plan, and is it updated every year?
Wow, that was 9 years ago. I know the facility where I received my treatment, we went to a class, survivorship. They talked about nutrition, just different things. I don't recall having an annual plan that was updated. No, that's an awesome question. And that didn't happen. And I think I went maybe for 3 months. You know, there was the initial meeting, and then the person had like weekly meetings with different individuals on different topics that you could attend. But I don't recall having anything that extensive. And I think that's an awesome idea. It never occurred to me. But so no, the answer to the question is no. I went initially, but there was no annual update.
Okay, thank you. All right, question for Jade. So as when you were going through your pediatric cancer, of course you were younger, and I'm sure you didn't know a lot that you know now. If you could put yourself back there then, or if you can even provide some feedback for a mom or a dad, what type of advice would you tell them to kind of, what should they be advocating for at that stage in a pediatric cancer?
Depending on the age of the child, I would say is going to really determine what kind of conversations you can have. I think as most parents that I knew when their children were smaller, we tried to make that environment as fun as it can be. We tried to kind of shift the focus, have game nights. The hospital will always have some type of event going on to kind of keep us entertained, if you will. But as your child ages, especially as they go through the healthcare continuum, especially during the teenage years, we're more knowledgeable about what's happening around us, what the treatments are actually doing to our bodies. So I think it's at that point when you can have those candid conversations, and really, it's a great time to really build a relationship so that they become more comfortable with provider communication as well. What I found is as I aged, as I got to a certain point where I aged up in the continuum of care, initially that shift was mostly focused on my mother and the adults in the room. And I was kind of just like the fixture. But as I transitioned into adult care, I had a hard time finding my voice, being present in those conversations, and feeling like I could be vocal about, hey, I'm not feeling very well, about this. And I feel pretty low on these days when this happens. So just set the tone and set a platform at the table. Maybe would be a good time during dinner time, or when it's just something casual that you guys are doing. Just make space for those moments and provide environments where they can feel comfortable sharing. Ask probing questions. How are you doing? How is the treatment really making you feel? You look like you're doing okay, but let me know more. And that will create a more comfortable station for them to feel like, okay, this is a safe space for me to really share that I'm not doing okay. I have pain here or discomfort here. I don't know how to articulate it. Sometimes we can't put it into words, or sometimes we may see the people around us. As far as for my knowledge, I didn't realize that the people that I came into with had not had success in their journeys. And so I developed survivor skills. I didn't know that's what that was at the time. So it's finding ways to have those conversations. That way we can feel emboldened and empowered to share with you guys and our providers as well.
Thank you. All right, and this is a question for whoever feels comfortable answering it. The question is, upon the end of treatment, did you have discussions about fertility with the healthcare team? What are some questions that may need to be asked during this stage if you need to explore if fertility will still be an option for you in the future?
That's a great question, Katrina. And as a younger woman still of childbearing age, that discussion was not really had about fertility. I didn't have to do chemotherapy, but I have to take tamoxifen for 5 years. And, not that tamoxifen necessarily affects fertility, but you should not get pregnant while taking tamoxifen because of the damages that it can do to the fetus. But I felt that I had to ask about those things. I would say my medical team, nobody proactively asked me, okay, well, you're single, not married. You don't have children. Do you want children? Is it something you're thinking about? Do you want to be referred to a reproductive endocrinologist to see what options are for egg freezing if you are worried about stopping tamoxifen to have children? So that's a very I would say elephant in the room that's not usually addressed as often as it should be for young couples. And if you have cervical cancer and you have to have a hysterectomy and you're still a woman who would have been of childbearing age, what does family planning, what does that look like for you now? So I feel that reproductive counseling and also emotional counseling regarding those things, because those are decisions you have to make sometimes before treatment even starts. Sometimes treatments can kill that dream altogether. So you have to know and do research ahead of time to know what your options are and what alternatives are available to you in certain situations. But it's definitely not addressed enough. And I would also say, since we're on the lines of talking about the reproductive system, another thing that's not really addressed is sexuality. Whether it's a young cancer survivor, an older cancer survivor, your body is forever changed. Your body image changes. If you suffer from anxiety and depression, your mind, you're just not in an emotional space to be intimate or share intimacy with a partner. Like I said, me being a single woman and having to date, having to disclose to someone that you had a cancer diagnosis, that's heavy stuff to put on someone. And a lot of times that is not addressed. Even in the older population, I have a lot of patients that come in and ask me about those things and how can they get back to those activities, but it's not usually talked about with their medical providers. And so for some reason, people shy away after talking about sexuality after cancer diagnosis, but it is a very important piece of the puzzle for a lot of people to be able to, some people go through cancer. The last thing you want to have is somebody touch you and poke you and prod you because it brings back all those, feelings of, fear and being checked for tests and things like that. And so some people don't know how to get back to intimacy. They don't know how to tell their partners how to, how they want to be touched or how they want to feel emotionally. So it's such a huge missing piece, I feel like, of a survivorship care plan is to address not only the mental health aspect of a cancer diagnosis, but trying to get back to that level of intimacy, to feel human, to feel like a person again.
Dr. Champion, I was thinking that the other elephant. I'm so glad you brought that up. For breast cancer, and a lot of women define themselves by their breasts and their physical appearance. I was that girl, I admit it. And so for me to make a decision to have a double mastectomy was traumatic initially. And eventually I had to focus on my health. I am, you're not your hair, I'm not my breast or whatever. But that's a transition. That doesn't happen overnight when that's what I was accustomed to. I was that girl, I admit it. And I think what I've done for other women is women need to talk to each other. And that's a safe space because doctors, for some reason, they're not going to broach the subject. And also, Living Beyond Breast Cancer has a great website for women. And they talk about all types of issues and webinars and information. I think that's lbbc.org or whatever. But that's another great resource for women to go to just talk about things that you may not to read about and listen to other women and other webinars about things that you don't want to talk about. But, you know, I talk to my girlfriends, I talk to other people, and initially I had to resolve that within myself. But I was that girl, I was vain, I made the decision, and I chose life. And I had to shift my focus on what's important. But I'm glad you brought that up, Dr. Champion, because we don't talk about the sexuality, we don't talk about the image, the sadness. There's a sadness associated with, and there need to be more of those conversations. Single women, and you know, I have friends who are married, and they don't have those conversations either, because it's tough, and it should not be something that, you know, hush hush. We have to have those conversations, and it's okay.
And we can't forget about our men either. Body image issues happen not only just with women, but with men. For example, I rehabilitate men after prostate cancer surgery, and a lot of times they go through the androgen hormone replacements, and that can do some damaging things to a male body. And so I've had men express issues with, you know, they're fatigued or they have weight gain that they can't get rid of, or even for women, you know, certain medications cause weight gain and bloating or loss of appetite. Some people are already thin and then they lose more weight because they don't have an appetite for whatever reason from their medication. So body image across the board, whether it's young, old, I've seen it, your hair changes, your skin changes, the texture of your nails change. And, you know, especially if you're at a place you're trying to get back into a working environment and you're worried about, is my hair going to be okay? You know, my skin is peeling. Is that going to deter clients from wanting to see me because my skin has changed? Real valid concerns that a lot of people are afraid to talk about and mention with their healthcare providers. I tend to spend an hour with most of my patients, so they get on the table and they tell me all of their innermost thoughts and feelings. So I feel like I'm a counselor in that way as well. But it's very eye-opening to hear the range of body image issues that people experience across the board.
Yes, I'm so glad that you brought that up. And those are, I think all of those could be their own webinar subject because they're all so important and all so unique. And I love what you said, Marquita, about looking at maybe webinars or educational things that you can watch without having to communicate that to someone if that's something that you're not comfortable with at the time. You can even, there are online cancer forums that people could use as well if they wanted to ask questions. And then you also have some groups that provide like peer-to-peer support from other cancer survivors. So those could be good places for that if you don't want to talk to your provider about it. We actually had a session about 2 years ago with some healthcare providers about sexuality and how they can actually start those conversations with survivors. And it's very important. No one wants to talk about it, but it must be talked about. We must talk about it so that people can just relieve all of that pent up stress that they feel from carrying around that feeling. So it's very important that we have those conversations. All right. So my last question for you all today is we've talked a lot about how survivors can approach their healthcare providers about different questions and advocate for themselves. But what are some ways that you can actually self-advocate for yourself with your family and friends? I think that's something that we don't talk about sometimes, but there are often things that we need to advocate for with them. So how can they support us better in our journeys? And I won't say our because I'm not a survivor, but I'm so used to talking to groups and kind of putting myself there. So I do apologize for that. But how can survivors advocate for themselves and communicate their needs?
I think a very important thing would just be communicating to people what you need. Not everybody will know. Some people will want to help, but they don't know how to help. And so to self-advocate, you need to be able to tell people what you need. You know, some people may say, well, I want to bring you 5 meals for the week. And you may say, you know, I don't need 5 meals, but I need that prayer or that inspirational story or video that you're going to send to me. So communicating your needs to your family and friends. Let them know what you need. Try to be transparent about it. And it's not that you're hurting someone's feelings by saying what you need. Not that what they're not doing is not helpful, but you just want it to be more impactful and more helpful to you, because it's so overwhelming to have to deal with treatments and then have to take care of, household activities, meals, activities with your kids, just other life things that go along with that. So letting your family, friends, your support system know exactly what you need and when you need it is so important. And I always say, help them to understand what it is you're feeling and what your body is going through. Because some people can say, cancer fatigue is real. And like I said earlier, it's something that can last years after treatment. And, you may have to say to that husband, no, I'm not just being lazy and not wanting to do anything. I really don't have the get up and go to be able to do what I need to do. And a lot of people don't understand that. A lot of people think that, okay, you're through the cancer treatment. Now you're fine. Now you can go and hang out and you can do whatever it is. But they need to understand that your body has gone through a lot. It is a process, and it takes time to get back to, those normal activities. And it's okay to let people know that you're not okay. And that's something I had to learn, to tell my family, I'm not okay. I have my moments of, like I said, you kind of sink into a little bit of that depression. And I'll be honest with you, just seeing in my profession, working with cancer patients every day, it can be a little bit triggering because I feel like I never get a break from talking about cancer. So just letting your family and friends around you, just to make them aware of that, so they're a little bit more forgiving and more compassionate about what it is you've been through, is definitely a good way to advocate for yourself.
I would say from my, sorry.
I'll go. Wow, I think there are two sides to that story. And I agree with you, Dr. Champion. You should ask for what you need. I had feelings of abandonment because after after 2 weeks, there's a revolving door of people. After you have your surgery, everybody's coming. And after a while, I think people think you're okay. And so eventually I had to ask for help. But the other side of that coin is I tell people, if you know someone who has had surgery from cancer or who's finished their treatment, just show up. Because oftentimes people won't ask for help for whatever reason. I agree we should, but people just won't ask. And, I just show up, because whether it's walking the dog or even if they have a husband, he needs some help, or the partner needs need help. Going to the grocery store, just show up and do whatever. Because oftentimes patients will not ask for help. For whatever reason, we just don't. And I did that. I felt abandoned. And then I'm thinking back, maybe I should have. But now I just tell people to just show up, because there is a need. That, people you may assume, don't assume that a person's okay. If you know a friend or you know someone, don't make the assumption that they're okay. Continue to show up until you feel like, okay, everything's okay. But yeah, I agree. Ask, but then, just show up for other people.
I love that. I think we always say, let me know if you need anything. And 9 times out of 10, the person's probably not going to let you know. So sometimes you just have to take the initiative and do something that might be appropriate for them. Jade, you're next.
I was gonna go back to something Dr. Champion said. It just, when she was speaking, it just spoke to me about kind of aligning with healthy boundaries. As a youth being diagnosed, you kind of get pigeonholed in this stay in a child's place mentality with people around you in certain situations when it comes to your friends and family. A lot of mine are older. My closest friends are older than me, so they are mothers and they have families. things of that nature. So I'm the youngest one in the bunch most of the time. And so what I did learn and develop over time, having their influence, is how to project, is how to be cognizant of when I feel like I'm not being heard, and how to pivot in a way where people actually listen and take in the information. Because sometimes I think because we get in that, oh, she's, she's just doing this, or she's just that, she's the youngest one, it's easy for your voice to be muted, silenced, or just brought down an octave. And so when I noticed that if I change my dialect, my tone, it kind of makes people sit up a little bit more and say, oh, well, what is she saying? And their ears open up a little bit more. And so with those different cadences and inflections. So what I would say as far as an AYA and learning how to self-advocate in those spaces is set healthy boundaries. Know what information that you feel comfortable sharing with certain people. You don't have to tell everybody everything. It's okay to keep and reserve certain things just for yourself, or just for maybe an even smaller circle of support. Because not everybody is going to be receptive to the things that you're saying or things that you want to experience in life. And sometimes you just need to have that group of people that are what I call your co-signers. You already know you're going to do the thing. You just need somebody to champion and support the idea of you doing the thing. And sometimes it's not always, our immediate familial tribe. Sometimes that's our circle of friends, that's our support group. But you've got to know which gardens that you're tending to get what you need. And that would just be my spiel on that. Katrina.
All right, thank you, Jade. Yes, that's very important. And we all know in the South, children have to stay where they are and not say certain things. But when you become an adult, and even sometimes as a child, you have to speak up for yourself. So very important. Well, I thank you all so much. This has been such a great conversation, and I know this will help so many women. I do want to go ahead and take questions from the audience, and we do have one already. The first question is for Jade. It says, Jade, do you have any long-lasting physical symptoms from your treatment? You mentioned chemo brain.
Yes, so chemo brain is one of the things that I noticed as I get older. I think it has influenced my cognitive abilities for memory, as I mentioned earlier, and just retention of information. Sometimes I'm very actively a writer by nature. I take notes all the time. And that's, I think, just as a secondary step, if you will, my body just innately does that because out of fear of maybe being forgetful. I don't want to be in certain spaces and be embarrassed because I can't remember the question that someone just asked me and have them repeat it multiple times. But I also, because of my chemo treatments, have rheumatoid arthritis. I was diagnosed with that at age 22, and it took quite a while to diagnose because like my ovarian cancer, being my age, it mimics so many other things that could have just been. But we were able to pinpoint that. And that's something that I have to manage wisely because due to those chemotherapy treatments, my kidney functions, depending on the medications, kind of are one of those things that just get wonky. So that's a lasting effect that resulted from the treatment. And I just manage it as best I can. I'm not one of those people who's really prone to taking a lot of medication. I think because during my treatment, I probably would say I definitely developed like a bit of a PTSD with the whole just being a patient in a hospital environment and taking so many medications at one time. I think 32 pills a day is just a lot. And so that helped me develop my aversion to it. So I only take the things that I have to take absolutely when necessary. But and my providers help me with managing that as pain management as well. So those are the main things that I've had other than my joint issues with my RA. Thankfully, that's it for right now.
All right, thank you. Do we have any more questions from the audience? All right, well, I will share just a few resources to leave you all with. Give me one moment. All right, so I did want to share these resources that will be very helpful in just life after treatment and surgeries, life for self-advocacy in these different spaces. So one, we do have Georgia Core's Unmet Needs brochures, which are on our website. Those have many different resources for survivors to take advantage of in all of those areas that we talked about earlier. So those physical areas, those emotional areas, spiritual and practical areas. Also the patient card that I showed earlier is on here. We also have a few toolkits that organizations have come up with that can actually help you with some of those conversations with your healthcare providers. So they have specific questions or they have worksheets in there that you can use when you're approaching those conversations. And so many more. We will actually share this resource guide after the webinar is over, so you can go on and just click on the links from there. But I did want to make sure that you had these. And then we'll also share the resources that we shared on last week if you weren't with us on last week's session. Lastly, if you would like to join our Survivorship Advocacy Council, feel free to email me at kdavis@georgiacore.org. The Survivorship Advocacy Council is a group of survivors, healthcare professionals, and even navigators that come together to give Georgia Core and the GC3 perspective on where we should be concentrating our efforts, but to also help us develop educational materials for survivorship, help disseminate that information, and then also help advocate for cancer care programs in Georgia. If you'd like to connect with us, you can find us at georgiacancerinfo.org. You can also email us at info@georgiacore.org. You can join the Advocacy Council, like we just talked about. And we also have a Facebook, LinkedIn, and a Twitter page that you can connect with us on. So we have everything for you to connect with us, and we would love to see you in one of those different spaces. Again, ladies, I thank you so much for your time tonight. I've learned so much from here, being on here with you, and I appreciate you for sharing your voice and sharing your stories with us.
Thank you, Katrina.
Thank you
so much.
You're welcome. Thank you. I hope everyone has a great evening, and we'll follow up with you soon.